I live in Jersey. I'm a married man with 2 children, and I had a problem with my heart earlier on this year. I noticed that I had a tightness in my chest, and so I went to see a GP who referred me to a specialist in Jersey, who then referred me to a specialist in Oxford, having done some tests in Jersey. He thought there was some sort of issue. The surgeon in Oxford performed a procedure on me which was unsuccessful, and the problem I had was that my heart was fine, but the arteries to my heart were blocked up, and one was blocked up totally. What that meant was that my lifestyle, I couldn't do very much at all. I couldn't walk for more than 100 yards or probably less without sort of having to stop. And so the surgeon in Oxford performed this procedure on me, and that was unsuccessful, sadly. And he then referred me to where I am now, Edinburgh, to a gentleman called Dr. James Spratt, who's eminent in this type of complex heart surgery.
The particularities of Mr. Knight's treatment were that he had a blocked right coronary artery. The heart normally has 3 arteries. The right coronary artery lies on the inferior surface of the heart. And what made Mr. Knight's case particularly difficult is it was densely blocked and full of calcium. That makes the artery much harder to penetrate with our guide wires. And in Mr. Knight's situation, we used a special technique in which we bypassed round the plaque and re-entered distal to the plaque into the distal artery. The good news from Mr. Knight's perspective is that it did not require general anaesthetic. The procedure was done within a couple of hours, and Mr. Knight was able to be discharged the same day.
Believe it or not, I've just come out of the operating theatre several hours ago. In the past, they would have had to sort of do massive intrusive surgery in going through your chest, but they go in through your arterial veins in your groin. It's much less intrusive than the alternative. I came in the morning and was greeted downstairs at reception. A couple of smiling ladies were very kind and helped me out, and then the lady that's been looking after me all the way through today came down, and she's been amazing. And she took me upstairs and then told me what was going to happen, and I pretty much knew what was going to happen anyway. And you walk down to the theatre, I think they call it the lab even, and then everybody's there, everybody's friendly, everybody's chatty, and the procedure starts. And so it's it wasn't very painful. It was some discomfort, as you would expect, but it was just start to finish. You were being informed all the way about what was happening, what they were finding. They'll tell you if you're going to feel some discomfort. A couple of times James will come and check on me, and the other people are saying, "Are you okay? Are you comfortable?" And then as the procedure's going, they're sort of, we're pretty much done now. This is good. That wasn't quite so good. We were able to do that, and so it just gives you that confidence. You just feel that you're in the best place and in the best hands.
The good news is that Mr. Knight has done extremely well, that the symptoms he had before, limiting chest pain, breathlessness on exertion, are now all completely resolved. He no longer has any angina, he no longer has any exertional limitation, and he's able to live a full and active life. So I think the message for patients with complex disease and severe symptoms is that simple angioplasty may not always be achievable, and referral to a CTO specialist may be required. And if that referral is activated, then the CTO specialist can get very good results both from a clinical and an anatomical perspective in patients who otherwise wouldn't get treatment.